what's the most rewarding part of being in practice and why?
So I really think the most rewarding thing for me is, I guess, kind of twofold. The first thing is just the opportunity that presents itself to meet and interact with different people. Um, Meeting people from different backgrounds, situations. I feel like I have made over the years thousands of friends.
Mhm.
So I really like that interaction with people. And then, I'm still waiting on what I call my case that once it occurs, I will probably be retiring. But and that is when there's a case that is just life changing. I just completely changed somebody's life. And then I'm done.
So you're
But
looking for your Harvey Lillard.
I'm looking for my Harvey Lillard,
Me
right?
too. Me
Yes.
too.
I'm telling you every day.
I've been waiting for
Oh,
24 years for Harvey Lillard to walk through that door.
I'm telling you, the day that happens, I will probably be telling you guys so long.
Mic
But
drop. Boom.
but boom. But it does feel good though, in all seriousness. Just the small wins, like I said. So, I have patients who come in and they tell me that I've changed their life. I'm allowing them to do something that they hadn't been able to do. They haven't been able to run in years and now they're able to run again. Like, so those things, they are rewarding. They're just not my Harvey Lillard yet. But that does provide you a little bit of satisfaction and a sense of achievement to know that, like, no, I'm not necessarily, changing the world, so to speak. But for this individual, I did just make things a little bit easier, a little bit less painful, right?
Yeah.
And so I think it's the meeting of people, having those conversations. You would be surprised at the conversations that take place here, but also just really kind of helping people on their individual journeys.
Yeah. Does it ever occur to you? Because I know it does me, but there are times when I'll talk to somebody who's just so inconvenienced in their life by what they do to collect a paycheck. And then I come in on Monday morning to my practice and I'm seeing, and don't get me wrong, we all have those patients that you're like, ugh, they test you, man. Or they won't relax for an adjustment, or
Mhm.
they're fighting you and your shoulders sore from trying to move them, I mean, stuff like that. But
Mhm.
on the most part, 99.9% of the time, you say to yourself, you know what? I love what I do.
Right.
It's such a great, great thing. And you say what you said, where I've made so many friends and so many relationships, and the need to take care of these people means I
Mhm.
got to put my own worries and concerns aside, which, believe it
Mhm.
or not, is a great blessing. It's a wonderful thing
Right.
to do. And
Right.
so it's such a wonderful thing. But I don't know if that dawns on you like it does me from time to time. But man, I think it's great.
Yeah, I think, and I always say, that if a person asks me at any point in time, do you really like your patients? I can always say that I like about 98% of my patients, genuinely like my patients, right? And I think that number is really high because, again, remember, I'm primarily referral. So I just get a lot of the same people over and over again, right? Like
That's
this
great.
this patient that I like referred her 3 friends. Well, if I like you, I probably like them too, right? So, I mean, at any point in time, I really like overwhelmingly the majority of my patients, like,
Well,
seriously.
the truth is, you like them all. You just like some of them when they leave instead of when they come in.
Right. I like to see you come, but I love to see you go.
Hey,
Um, but no, I mean, yeah, I really do genuinely like these individuals on a personal level, right?
sure.
Which I think makes it also easy for me to really give them my all because I've heard so much about your children, I've heard so much about your family. I want you to be able to go to that game and sit without any pain, right? Like, I need you to be there. So I think that does really help in regards to the type of service that I try to provide. And and even with those ones that we don't necessarily get a kick out of seeing them necessarily come, oftentimes I found that that's because of pain, right? Like, these
Mhm.
people, they're in pain, there's something going on with them. And some of them turn into be the sweetest people once you really do give them the service that they were actually really looking for. But initially, you might have to kind of hold your breath a little bit and grit, right?
Yeah.
In the beginning. But once they're feeling better, I have turned it's been quite a few that I didn't think I would like, but I absolutely love, and they've been really long-standing patients,
Sure.
right? So yeah, I think sometimes that's pain kind of sticking through.
It's like you took the proverbial thorn out of the lion's foot.
Mhm.
Yeah,
Mhm.
that's definitely true.